On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Antibiotic Stewardship Webinar Series, Developing an Antimicrobial Stewardship Plan. My name is Christine Bingman, and I will be your moderator for this program. We welcome any comments or questions. All materials are provided for your educational use. Now I would like to introduce our speaker for the webinar. Joanne Atkins is a registered nurse and infection prevention advisor for the Patient Safety Authority. Ms. Atkins is board certified in infection control and epidemiology and is a fellow of the Association for Professionals in Infection Control and Epidemiology. Ms. Atkins is a 2019 recipient of APIC's Heroes of Infection Prevention Award for Education. She is a member of the Association for Professionals in Infection Control and Prevention and has served on the Member Services Committee, the Sigma Theta Tau International Nursing Honor Society, and the Pennsylvania Association Directors of Nurse Administration and Long-Term Care. Joanne, I will now turn the program over to you.
Thank you, Christine. Welcome, everyone, to the 7th webinar in our Antibiotic Antimicrobial Stewardship Series. Today's webinar is Developing an Antimicrobial Stewardship Plan. As you know, there is no one-size-fits-all approach to promoting antimicrobial stewardship in long-term care. Many of the action steps and strategies may already be in place at your facility, or they may be written into a plan and not implemented. The Antimicrobial Stewardship Plan incorporates the core elements of antimicrobial stewardship and stands as a guideline to help you develop and assess your program. So our objectives for today are to discuss the core elements of an antimicrobial stewardship plan, identify the core members of the antimicrobial stewardship team, and describe the roles of those members as it comes to helping develop the plan. So all of antimicrobial stewardship is required in long-term care as part of CMS's Regulation 483.80. The intent of that infection prevention regulation is to ensure that the facility develops and implements protocols to optimize the treatment of infections by ensuring that residents who require an antibiotic are prescribed the appropriate antibiotic. This regulation also reduces the risk of adverse events, including the development of antimicrobial resistant organisms, from the unnecessary or inappropriate use of antibiotics. And it promotes, develops, and implements, as part of the regulation, a facility-wide system to monitor the use of antibiotics. So for this to occur, your facility must develop a program that includes these protocols and policies and a system to monitor use. So what does antimicrobial stewardship look like in a long-term care facility? Well, it's a standardized process for eliciting information and communicating a change in a resident's condition from the CNA to the nurse to the provider. It's also standardized protocols for lab testing, standardized treatment algorithms, and evidence-based recommendations using your evidence-based criteria such as the Loeb criteria. But you have to make sure that your antimicrobial stewardship plan fits the processes in your facility and the culture of your facility so it will work within your facility. So there are strategic principles, and these are on the screen. The strategic principles of antimicrobial stewardship plan is ensuring a timely and appropriate initiation of antibiotics for residents according to current evidence-based best practice. It's also ensuring appropriate administration and de-escalation of therapy for residents according to current evidence-based best practice. Another piece of your plan is monitoring data for your antibiotic effectiveness, your antibiotic stewardship program evaluation, and any associated resident outcomes. And this is all done through promoting a culture of transparency, reporting, and open communication. So we all know it starts with a team, and this is just a quick review of the actual overall program because you need to have this in place to develop your plan. You need a champion, and then you gather your team, and it should be multidisciplinary. It may include your medical director, must include the infection preventionist, could include charge nurses, ADON, or your director of nursing, and pharmacy involvement and lab if possible. And once that team is in place and they know the roles and responsibilities, then you risk assess, see where your opportunities are or where you may already have some strengths, develop your timeline for developing your program and your plan, and then develop the individual pieces of your plan, such as your policies and procedures, and how you're going to provide education on these new policies and procedures to staff and providers. Here's your team membership on the screen. Your medical director or designee, your senior leadership, nursing leadership, infection preventionist, your pharmacist. Then it may also include, if you have an antimicrobial stewardship coordinator, as some larger facilities do, someone from quality, because we know that part of the regulation from CMS is that infection prevention has to be incorporated into quality. And also IT, if you have an IT program that can help you with data collection. Your medical director promotes adherence to the guidelines and antimicrobial prescribing, and he plays a key role in case you have other providers who are not on board with the processes of antimicrobial stewardship. You need your pharmacists because they are the experts. They oversee the treatment guidelines and the development of them and review inappropriate prescribing. Nursing leadership promotes assessment, documentation, and communication. Your infection preventionist is your resident expert. She provides expertise, education to your nursing staff, and also performs surveillance. Your laboratory, which for a lot of you is a contracted service, helps with the development of your antibiogram. Your antibiotic stewardship coordinator, if you have one, oversees all of the activities of antimicrobial stewardship, and senior leadership is extremely important because they can ensure adequate resources and help with employee buy-in. So if you are part of this team, please attend your regularly scheduled meetings. Your input is invaluable. Assist with tracking antibiotic use if so assigned. Provide monthly summary of reports on infections and antibiotic use, and that would be provided at both your infection prevention committee and also reported out at your QAPI committees. It's also important as part of the team to develop and then share prescribing profiles with your clinician, recommended by AHRQ on a monthly basis or can be done quarterly. And the entire team should review and update your policies and procedures to reflect the current guidelines. This is just an example with the link on the screen of the risk assessment for antibiotic stewardship in long-term care that was developed by CDC. It's a really easy to do checklist that evaluates your facility's preparedness in the core elements of antibiotic stewardship. It's one of the best ways to identify your weaknesses or targets for improvement and any gaps you may have in your plan. And then from there, you go on to develop your goals. And these are all part of your plan. You need both short-term and long-term goals, and they're based on the risk assessment you did and where your opportunities for improvement are. Use the results of that risk assessment and the information from reliable evidence-based sources such as AHRQ, CDC, SHE, to determine which strategy should take priority. So there are some minimal requirements for your plan. The antimicrobial stewardship plan and program goal is to improve appropriate and judicious use of antibiotics and antimicrobials. The plan provides the initial framework for your strategic approach to meet this goal, and it establishes accountability for the program's activities and outcomes. Your plan is your guideline. It is your written guide to follow. Use existing resources, and your plan should include, at a minimum, a statement of leadership support. Identify the resources to provide education, to download or develop materials. Should outline a timeline and responsibilities, the budget, meeting schedules, and meeting agenda for your antibiotic stewardship team and program, and should also outline sustainability strategies. We're going to talk about them in a little more detail. Leadership support is critical to the success of antibiotic stewardship programs and can take a number of forms, including a formal statement that the facility supports efforts to improve and monitor antibiotic use, have stewardship-related duties in job descriptions and annual performance reviews. Leadership support can ensure staff from relevant departments are given sufficient time to contribute to stewardship activities. Leadership can document support for training and education, and can help drive accountability by ensuring participation from the many different groups to support the stewardship activities. Another piece of leadership support is financial support to augment and impact the stewardship program and include time and technology resources. When it comes to resources in education or in communication, how are you going to communicate new procedures to staff in clear, easy to understand manner? And this all becomes part of your plan. What is your plan for doing that educational to your staff? Also include information of your timeline for implementing the program, and your plan should include a copy of the policies and procedures relevant to antimicrobial stewardship. Depending on the scope of new procedures, training for staff and prescribing physicians may also be needed. Another part of your plan is the policies that support optimal antimicrobial use. Ensure that current medication safety policies, including medication regime review, address the regulation from CMS and are being applied. Like I said, I have been in facilities, and I'm sure my co-workers have also, that have a written antibiotic stewardship program and a plan, but it has not been enacted, and the plan is obviously not in place within the facility. So you need to take a good look at your plan, update it annually, and make sure that the processes are in place that are part of your plan. You need to standardize practices for the care of residents suspected of an infection, and look at your prescribing policies and practices within your facility. And then you need resources allotted to develop these policies and procedures and education, and how will you distribute them? Education is provided not only to your staff, but also to your providers, your residents, your family members, and visitors that may enter your facility. Another part of your plan is implementation. The antimicrobial stewardship team needs to develop a timeline, responsibilities, budget, and schedule for team meetings, so that implementation happens within a timely manner. This is when the team needs to look at the facility's unique characteristics, needs, and resources, and think about specific items. And this is where you need leadership support. What are the costs for supplies and staff time? What needs to be carried out to implement the antibiotic stewardship program? Can the existing resources and workflows within our facility be adapted to meet the needs of this antibiotic stewardship program, or will new materials or resources be required? That's all part of what goes into your plan. And then another big part of your antimicrobial stewardship plan is how are you going to sustain your efforts once you have put them in place? A big piece of your plan is planning for sustaining your stewardship. It's recommended to start small, tackle the parts of the project you know you can easily accomplish, and then move on to make sure you have sustainability. Your antimicrobial stewardship program and plan should be included in new hire orientation and then annually in staff education. And what that should include is a review of the tools, the policies, and the protocols for antimicrobial stewardship. It's also important that staff understand how to use the tools and integrate these elements into their day-to-day work. Your team and your IP also need to monitor progress and share results with key stakeholders, including your staff, clinicians, residents, and family members. Your antimicrobial stewardship data needs to be reviewed at your infection prevention committee, your QAPI committee, and with senior leadership. And then one thing I always tell people to do is when you have successes, celebrate them with your staff because they are a major part of implementing and maintaining antibiotic stewardship. Here's the definition of sustainability. Sustainability occurs when processes or improved outcomes last within a facility after implementation has occurred. Sustainability focuses on integration and continuation of a specific improvement process or long-term outcome. And improvement has become part of your culture, facility culture, and has been maintained regardless of your staff turnover is an example of a sustained improvement. Begin setting up your antimicrobial stewardship project for sustainability and spread. Engage staff and others, such as your leadership, outside entities such as a hospital, because many of you tell us how residents go out to emergency rooms for one issue and then come back with a urinary tract infection. So that's when is your team in communication with that local hospital and emergency room to tell them that you are working on antimicrobial stewardship and that you would like them to follow the guidelines. And make sure residents and families receive education. And we have a really nice tool I'm going to show you at the end of this presentation to help with that family and resident education. Another part of sustainability is how are you going to track your progress through the data? Are you going to look at CODI rates? Are you going to look at respiratory tract infections? Are you going to look for safety issues? And then incorporate your antimicrobial stewardship resources into your everyday processes. Use the tools. Use SBARs if you don't use them within your facility, and my coworkers and I can help you with that. Watchful waiting, educational posters and brochures for staff, for visitors, for families and residents. And then set up routine scheduled antibiotic or antimicrobial stewardship education for your healthcare workers. But I'm going to tell you again, please use the tools. There's some excellent tools out there that can help you with this. And a big piece of this is education. It is important to provide regular education, annual education and training about antimicrobial stewardship to your bedside care staff, your providers, your licensed independent practitioners. Consider including findings from antibiotic stewardship assessments and utilize the tools to educate and train nursing staff at all levels within your facility to promote timely and accurate recognition of potential infections. Make sure your staff know how to do a good assessment of that resident. Nothing ever beats a good assessment when it comes down to deciding if they have the signs and symptoms needed. Make sure you have a good process in place for communication of those signs and symptoms, not only from the CNA to the nurses, but then from the nurses to your providers. And then make sure documentation is included of any change in that resident's condition. Some of the tools that we often use are SBAR forms, and the Agency for Healthcare Research and Quality have some excellent SBAR forms. We use watchful waiting. We use antibiotic timeouts. There are many tools out there that can assist you with your antibiotic or antimicrobial stewardship plan. And a big piece of this, as with everything in healthcare, is communication. Develop and communicate the expectation to all healthcare personnel, including the licensed providers in your facility, whether they are employed by your facility or they are contracted or an external consultant, regarding what their role is in antimicrobial stewardship. Communicate antimicrobial stewardship messages to all staff. That can be done, for example, through staff meetings or huddles or newsletters. Make sure you're communicating antimicrobial stewardship messages to families and visitors and residents. That can be done through family council meetings, brochures. You may have a newsletter that is distributed to residents and families, but make sure they are aware that you are working on antimicrobial stewardship and why. And all of this is part of your antimicrobial stewardship plan. When you develop policies based on the best practice, evidence-based practice standards, make sure they are communicated to both staff and also your providers. So have a standardized process for this communication, and this becomes part of your plan. SBARs, they're there, they help you collect the data needed to then communicate with your providers. There's also Interact, Stop and Watch Early Warning tools. There's the communication tool, the Concerned Uncomfortable Safety Communication tool, Changes That Matter tool, antibiotic timeout policies. All of these tools are out there that help standardize the process of communication from the bedside through to the provider. And we strongly recommend that you utilize some of these tools within your facility. When it comes to your policies and your protocols, they're based on clinical practice guidelines for the initiation of antimicrobials. And one of the common ones that used is the LOAB criteria. Make sure they're followed by the licensed providers in your facility. And then conduct antibiotic use assessment and provide that feedback back to those providers. Make sure that your providers are following the 5 Ds of antimicrobials, that it's the correct diagnosis, the correct drug at the right dose for the right duration of treatment, and it is de-escalated when it's possible, because we always want to go from broader spectrum to narrow spectrum. Make sure your pharmacist is engaged. They are the people who have the knowledge when it comes to all of these drugs. Specifically, have them ensure that when they're filling antimicrobial prescriptions, that they're making sure they have the correct elements documented. The diagnosis, the treatment indication or rationale, what site is being treated, is it a urinary tract infection or a respiratory infection, the right drug, the right dose, and the right duration of time. And make sure that you have assistance from your pharmacy and from your lab in developing an antibiogram, and then make sure your providers have access to it. This is just a diagram from the Minnesota Department of Health that really outlines nicely the many steps of an antibiotic or an antimicrobial stewardship program and how they all interconnect. And I put this in here just for your use and review, because it shows you how, from the presence of symptoms, that's then communicated, what nursing needs to communicate, accurate, timely assessment, good communication, and excellent documentation to the provider. And then they need to make sure they're following the 5 Ds of antimicrobial stewardship, that we have a diagnosis, the correct drug at the correct dose for the correct duration of time, and then we de-escalate if possible. So I put this on just for your review, because it makes it a nice flow chart for you as you're developing your plan. So one thing I always try to do is give you some tools to assist you with your plan. And you can contact The first is the 3 IPs at the authority. Between us, we have well over 50 years of infection prevention experience. Our contact information is on the screen. If you have questions on antimicrobial stewardship, if you're looking for certain tools that can help you with this, please reach out to us and let us discuss it with you and walk you through it. And then the tool I wanted to highlight was developed by Christine, and it is a wonderful tool. I think many of you will be very happy with. It is a safety tips on antibiotic stewardship directed at your residents and their family members. The link for it is at the bottom of the screen, and Shelley's also putting it in the chat box. But this very nicely explains on an easy to understand level why antimicrobial stewardship is important, when they do not need to take an antibiotic, and what the risks are of taking that antibiotic. So if you have not seen this, and I know we had many entities send it out, including ourselves, please pull it up and take a look at it. It's shared governance. It's for your use. You can print it out and distribute it to your family members or your residents as needed. But it's a wonderful tool, and thank you, Christine, for developing that. Here are some resources to help you with your antimicrobial stewardship plan. We have, of course, the CDC's core elements, the Minnesota Department of Health. I would pull up next to. They have a wonderful toolkit out there for developing an antibiotic stewardship plan and policy. And they're the next 2 links on that screen. And then there's some other links there on antimicrobial stewardship. We have some actual tools. You can click on these links. Here are SBAR forms from AHRQ. And the link for them, the Stop and Watch Early Warning Tool link, the antibiotic timeout protocol that was developed here at the authority. And then there's articles that we had written in the past on antimicrobial resistance that highlights the use of antibiotics within Pennsylvania. And since UTIs are a very common infection in long-term care, we have a UTI case review form that was developed when we ran the Antibiotic Stewardship Collaborative a couple years ago. So I'm now going to turn it back over to Christine to see if there are any questions.
Thanks, Joanne. That concludes the slide presentation portion of our program. Now we would like to begin our question and answer period. Okay, Joanne, we have a question. Why is it necessary to provide antibiotic stewardship education to the CNAs as they don't pass medications?
It is very important that your CNAs understand the basics of antibiotic stewardship, but even more importantly, provide them education on what is actually the signs and symptoms of an infection. Because as staff is short and they get busy, I always recommend that the CNAs are taught the signs and symptoms from the McGear criteria. Just because we'll use UTIs, for example, just because urine is cloudy or foul smelling does not mean that it is infected. And we don't want to send off urine cultures without true signs or symptoms of a possible infection, because we know that the elderly, many of them are colonized with bacteria in their bladders. And if you send off a culture based on cloudy urine, but no other signs and symptoms of an acute infection, such as a temperature or things like that, you're going to get a positive culture back. And then your provider is looking at a positive culture and may prescribe antibiotics that are not necessary because it could be a colonization, and we never want to treat colonization.
Thank you, Joanne. I want to thank everyone for joining us today. If you experienced any issues accessing the evaluation or certificate of continuation, please feel free to direct any inquiries to Shelley Mixel at SHMIXELL@pa.gov. This concludes our webinar.